Are we live? Hey guys, this is Bobby Clue with the Somerset-Pulaski Chamber of Commerce. We're back at it again for another one of our virtual ribbon cuttings. We're live today. We're out here in Medpark West. I'm here with Gail Cummins, Outreach Director for Brightview Health, and wanting to learn a little bit more about what Brightview does. You've got a beautiful facility out here. You know, Medpark's the cream of the crop.
It is the place to be.
We actually just gave Brent Cherry our Entrepreneurial Success Story Award, so love coming out here. And Gail, thank you for taking the time to do this. So kind of in frame of reference on where we're at here, we're next to LabCorp and across from Advanced Pharmacy.
Exactly.
So Advanced Care Pharmacy, another Business of the Year winner right there. They
Right.
won one of our awards the other night as well. So we're very centrally located. I think it's probably our second right when you come in.
Right past the surgery center.
Can't miss it. So wanted to kind of give everybody a frame of reference, because you could drive around out here and get lost real easy.
Yes, you can. Yes, you can. So, I got a gentleman back there and go, yes, you can.
So now that we know where Brightview Health is located, tell us a little bit about Brightview.
So we are an outpatient substance use disorder treatment center. We'll treat opioid addictions, any kind of drug and alcohol addiction.
Outpatient. That means they come here, they get their treatment, and then they leave.
Absolutely. It's like having a doctor's appointment. You come back and forth, and that's really one of the things that I even heard a patient say that really made me feel good. They came in, and they were in the waiting room, and they said, you know, this looks like a doctor's office. And she said, I think they really are going to think there's something wrong with me. I'm not a bad person. And so I really like being here, because we do want to get rid of that stigma. We want to really promote that, you know, addiction is a disease, and that's what we're here to treat. And
the outpatient treatment, I believe you told me, is something not everybody does.
Exactly.
Lots of treatment options here locally, but not all of them do the outpatient.
Right.
So that's something that you kind of specialize in?
That is all we do. We're pretty unique in that, and we also take walk-ins, which is, I think, another thing that sets us apart. You don't have to have a referral. You don't have to have an appointment. As long as you get in by 3 o'clock that day, we can take you and get you everything that you need to get you started, and that's a big plus.
Is there any way you might be able to show us around a little bit? Is that possible?
Absolutely.
Well, I'm going to follow you, Gail. Please come on.
Thank you.
So, you know, everything out here is built to design, I'm pretty sure, by the person that's out here, and it's a beautiful facility, and you've got a pretty large facility.
We do.
Here.
We actually have 2 suites here.
Okay.
We have 2 suites, and you know, when you come in, pretty much in any Brightview site you're going to be in, we're going to look very, very similar. We want that continuity, because if we have patients that have to go from one place to another, they're going to walk in and have that familiarity. But when they come in, of course, you can see we are kind of set up like a doctor's office. We have snacks, we have a TV. We do not have magazines from 2000, which is really nice. That separates us from the doctor's offices, which is good. But then also, they'll come in, and we have our patient service representative here. She checks people in again, like a doctor's office, makes sure they have their insurance. And then we go on, and I'll kind of give you a little walkthrough about how someone their first day would be.
Well, we can do that. And while we're kind of talking too, so pretty big outfit you've got here. You're in multiple states,
we are.
Multiple locations here in Kentucky.
15 locations in Kentucky. Well, 14. We've got Pikeville opening up soon.
Oh, that's exciting.
We have over 80 locations throughout the country right now.
Okay. How many states do you know? It's 5, 6, 7, quite a few?
I don't remember, but I can find out, because there'll be somebody along my way.
You've got a good website, and I know that it's all on there as well.
That's a great website to get to.
Absolutely. Well, give us a little tour.
When someone first comes in, one of the first things we do is we do just a really quick medical assessment on them. We'll do a screening. We make sure that, you know, we get a little bit of history. We start the process here where someone will kind of start asking questions, let them know, hey, this is going to be a tough time. We're going to ask you a lot of questions, but we need as much from you as we can get to help you. So they start off here. We also do an initial drug screen, and we have our own lab. So
the people that come in, are they traditionally, how do they find you? Are they finding you from a referral? Are they finding you from an advocacy? Are they just walking in because they need help and they found you in the yellow pages? So how are they finding you?
We have a really good mix. One of the things that I do is I go out to physicians' offices, to clinics, to a lot of our community-based organizations, letting them know who we are, what we do, so we get the referral base. And then I do a lot of street outreach. So I go out and I put, signs up, and I'll go to a lot of the places where people are camping out.
Sure.
Making sure that I introduce myself, and I always leave some information. Just say, hey, if you're someone needs some help, we're here. We can get you the help you need.
So you're meeting with these people, maybe some addicts that maybe they're not ready for treatment that day, but you someday, if they are ready,
Yes.
they know that you care, you've been there, and this is the place for them to come.
Right, and I keep trying to go back on a continual basis so that they know me, they trust me, and they know that I'm a resource for them, whether it's here or somewhere else.
Are a lot of these pockets where you're going to see these people, are they pretty, where they're all at? I mean, I know that we've got an ever-growing homeless population here, but I think when it comes to substance abuse, it's a much larger collection of people, but they all kind of congregate in certain areas.
And we have to keep in mind, not everyone that is homeless is using.
Absolutely.
It's unfortunately universal, from your most prestigious neighborhoods down to the camps.
Yeah.
And we see it everywhere, and that's kind of where we really want to let people know that we're going to treat you like a person. We're going to treat addiction like a disease. If you go to see someone with a heart condition, they're not going to say, oh, we've got you stabilized, see you later, bye. They're going to say, okay, let's see what's going on.
Right.
That's what we do when you come to see us. We're like, okay, we see this is a problem now. Let's deep dive and see what's causing this. See what we can do to help you.
Okay.
So I see we've got fingers going, so let's get you around here
No,
quickly.
we're always just mindful of everybody's time. We know how busy you guys are.
So we also have another waiting room in here. This is where if they're waiting to see either maybe the therapist or the provider, they don't have to go back out into the main waiting room. They can do that. Also, we do provide medicated assistance treatment, which means that we do the Suboxone, we do Vivitrol, if warranted. We don't do it for everyone. It depends on what their treatment plan is.
Right.
But if they need to do it as observed dose or want to, a lot of times if they take their first dose, they're kind of afraid, not knowing what's going on. They can come in here, and then we've got our nurses station right here so that the nurses can be very handy and kind of see what's going on.
So I hear those words for those drugs with
Suboxone.
I hear that a lot. What is that exactly?
So Suboxone is a drug that kind of lessens the cravings for the opioid.
So is that kind of to wean you off during the...
That is our goal, yes. Yeah. Yes.
So less and less of it, and eventually none, and then...
Exactly. I liken it to the diabetic. You can change things with diet and exercise, but you might need to be on something at the time. And that's kind of where we are. And then, of course, there's some people that they're healthy eaters, and they're always going to need insulin.
Right.
It just depends on the individual.
Gotcha.
But the goal is to, get them to where they can focus on really what has started the problem. And, the more that they learn to deal with that, cope with that, the less they have to
So who is doing that? Do you have trained clinicians here that that's what they're that's their job, is to have them kind of retrain their reboot their minds, so to speak?
Right. We have nurse practitioners. We've got our clinical director here that does the therapy. We also have case managers. So we don't just treat the addiction. We also make sure that they have everything else they need. If they need housing, if they need food, clothing, we'll make sure that they get those as well. And then, of course, if they need another service that we don't provide within our four walls, again, that kind of goes back to me going out in the community, finding out the resources. Yeah. And we can see who we need to refer them to.
I'm glad you touched on that, because it's a great reason that we do things like this with the lives. Is a lot of people can't be here in person to celebrate your ribbon cutting today, but they want to know more about what goes on here at Brightview, and they might want to know how to help. They might want to know if they could make a monetary donation or clothing or food or things like that. Is that things that they can bring here? How do they find out about ways they can help you guys?
We do try to keep a few things on hand for our patients. And then, of course, we also have the really good relationship with like God's Food Pantry, some of the other places there, Goodwill, that we can send people to. They work very closely with us.
Sure. I bet as community outreach, I'm sure those people are on speed dial with you.
They are. Sure. And same, if they need something, they call me as well. And, not even if it has to do with substance use. This community is fabulous. You can call anybody for whatever resource you need, and they're going to know somebody that can help you out.
It's a very generous community.
It is.
And it really is.
We do. We're very, very fortunate
generous
to have the
community
community that we have, for sure. Yeah.
Well, that's great. Well, thank you. Is there other?
Yeah, we have a lab on site.
A lab, okay. See if there's anybody in there. We don't want to.
There's
bother
not. And so this is where we do our screening, and then we will send samples off. We also have a lab in Cincinnati. That's
Sure.
where we're based from.
Just to kind
There we
of
go.
find out your baseline and to know where you're at with somebody who's coming in.
Right, and we don't just test to see, if it's in their system. We actually break it down to the nanogram, so we know exactly what people are taking and how much they're taking. We also do group therapy. We have a group room for them if we need that. We have a pregnancy program, so when we have pregnant women, we can have them come in and we work with them as well.
What are the biggest substance abuse issues that you see here locally? Is it heroin? What is it right now?
Really, meth is still the big one.
Is it really?
And fentanyl.
Fentanyl.
I mean, and I hate to say that because it's crazy, but that's what it is.
Mm-hmm.
That's what it is, and we're seeing a lot of fentanyl.
I think I saw something where 68% of American overdoses last year were fentanyl-based overdoses.
Yeah,
So
and
it's really took the lead.
Well, and I know we met with some gentlemen from the police department, and one of the things they were saying is that a lot of times individuals are thinking that they're getting heroin, and it's really fentanyl.
Yeah, talk to Daryl Kegley or one of those guys sometime. They'll tell you some, horrific stories about overdoses and how they
we work
occur.
really closely with them as well to kind of find out what we need to do to help them work with the hospital. So.
A lot of partnership. It takes a village, doesn't it?
It really does. It really does. And I think, one of the things that has been so positive about it is that, we're breaking down that typical drug addict. That's not even a word we like to use or a phrase we like to use anymore, because addiction is a disease and it affects everyone. There's no socioeconomic background that is, more prevalent than another. It's everywhere.
Yeah, we're big believers in second chances at the Chamber, and we've seen a real kind of shift in culture over the last 10 years or so, where I think people who used to maybe shy away from someone who's come through rehab, I believe now they're embracing those people and they're looking at them as a readily available workforce.
As they should, yes.
I remember Melissa over at Skyhope told us one time that, my girls, when they graduate, she said, they want to work, they're going to show up on time, most of them are going to show up early, and they can pass a drug test. I said, these are all the things that employers are looking for and they can't find.
Absolutely.
So, what you're doing really is you're really helping our bottom line here with employment. That's always going to be an issue. I don't know a single soul that's not hiring right now, and, what you're doing to help these people and get them back out into the workforce is greatly appreciated.
Well, they used to say that the main reason people wanted a college degree is they wanted to see you stuck with something for 4 years. I can tell you my 4-year degree was a whole lot easier than going through rehab.
I
and
guarantee
so if
it.
someone has made that journey and accomplished that, you're going to have that commitment. You're going to have that willingness to do.
Oh, I
Absolutely.
100% agree. And I see a lot of people that, they used to have real hard and fast rules. If you have done this or if you've been arrested for that, you can't even apply for a job here. And they've really started to loosen those regulations, and they're starting to look at this on an individual by individual basis.
Exactly.
And the real reason, more than anything, is that the workforce is just so thin right now that people have to really think outside the box on finding employment.
They're excluding people that they should have never excluded.
Exactly.
They're not excluding people with diabetes. They're not excluding people with heart disease.
Sure.
So you have to look at it from that respect as well.
Well, and it's great. It's that these people are getting that second chance that they deserve, and I really appreciate all the work that you do here, Gail, and your whole team. You got a great team here.
We do, and you'll get to meet them more here in a little bit. They kind of saw camera and everybody hid. So.
Well, once again, just as a couple things we always like to do, if somebody's watching this and it's touched their heart and maybe they want to walk in and they want to reach out to you guys, how do they get a hold of you all?
So the easiest way is to go to our website. It's brightviewhealth.com, or they can just walk in. Honestly, walking in is probably the easiest way to get to us. And we can go ahead, and if you're needing assistance,
and again,
we can get you started that day.
It's located, we're right here, right off Hale Knob Road, right across from the Pulaski County Detention Center in Medpark West. Come in at your second right, right across from Advanced Care Pharmacy, right next door to LabCorp. So it's easy to find, and if anybody watching this knows somebody that might need this, share it with them. You know, this is a
Absolutely.
great opportunity, and you know, everybody deserves that chance. So I believe Brightview Health is doing some wonderful work here, and
Thank
just
you.
want to thank you for taking the time
Great.
to do this. It's a great opportunity, a way to get a lot of people who couldn't be out here in person with us today.
Yeah, not a great
chance
day outside.
You know, it's a cold, you know, wet day. It's not a good day, but we're going to go out right now, and we're going to be doing an in-person ribbon cutting. We're going to brave that cold weather, and
Yes.
we're going to do an in-person ribbon cutting. But thank you again. Appreciate you being
Thank
a
you
chamber
all.
member. We know it's a choice you all have made, and we appreciate that very much. We don't take it for granted. And guys, we've got another virtual ribbon cutting next week. So thank you all for tuning in, and we'll see you soon. Thank you all.
Thank you.